Hello, everyone, and welcome to episode 83 of the Pet Behavior Chat. And I actually have a repeat guest with me today. We had such an amazing conversation a few months ago that we thought we would have another conversation. And this time it's going to be all about cognitive dysfunction syndrome, which is a disease that both dogs and cats suffer with. So I'm super delighted to have with us today Dr. Gaelle Joanny, who is based here in the UAE, like I am, and works for a company called Nova Pharma, who distribute a number of really amazing products, including the Hills Diet range, the Vet Plus range. So we're going to talk a little bit about some of the things that actually help to support our pets, our older pets with cognitive dysfunction. So welcome, Dr. Gaelle. So lovely to have you here again.
Thank you so much. It's always a pleasure to be with you and discussing scientific topics. Thank you for having me.
My pleasure. I would love it if you could introduce yourself a little bit to our listeners. Just give us your background, because you've got an amazing background and you are such a well-rounded professional. So I'd love to hear a little bit about your background and what brought you to the UAE and what your current role entitles.
Sure. So I'm Gaelle Joanny. I'm a vet. I earned my degree from the Lebanese University in Beirut. I have also a master's degree in quality control of food of animal origin. So my academic journey took me afterward to Italy, where I completed a PhD in veterinary medicine at the University of Sassari in Sardinia. And after finishing my studies, I returned to Lebanon and spent 6 years as a lecturer at the Faculty of Health Science at the American University of Science and Technology in Beirut. And it was during that time that I developed strong passion for nutrition, which led me to pursue a second degree in nutrition and food science at the same university where I was teaching. In 2022, I relocated to Dubai and joined Nova Pharma Group, where I currently serve as the Vice President of Scientific Affairs for the MENA region. In my role, I lead the company's scientific and educational initiatives. This includes overseeing all the training material for the team, internal training, conducting workshops for vets and also animal healthcare professionals. I deliver lectures, seminars. And my main area of interest is always in pet nutrition, preventative health, and the development of science-backed education content that support vets in the region.
Amazing. And I actually have one of my team, one of my nurses, actually our head nurse, Sarah, who's currently going through your Hills Nutrition Ambassador program. And she is blown away. Like every time she comes home from that, she WhatsApps me and like, oh my God, I have to tell you this. I have to tell you this. We're doing it all wrong. I've learned so much. So yes, I can vouch for.
So happy to hear that.
Yeah.
So happy. You made my day today. Thank you.
Good. No, honestly, the enthusiasm she comes back with obviously vouches for how amazing you are at delivering the content around nutrition. So yeah, she's loving it.
Happy to hear that. Thank you.
Good. So let's dive into our topic, which is canine and feline cognitive dysfunction, which I have done a couple of episodes on before, but we want to dive deeper into how we can actually support our pets that might be suffering from this disease. So first of all, just to kind of set the tone, this is a neurodegenerative disease that older pets can suffer with. We kind of think from around the age of about 8. And they show a number of different signs. And I know, Dr. Gaelle, that you are keen to kind of chat us through some of those clinical signs that we see, because there's also a great clinical tool available that pet parents can use. So do you want to chat us through what those signs can look like?
Sure. So usually we as a vet, we call them, we use an acronym called DISHA. And this acronym describes the key behavioral changes that appear with pets having cognitive dysfunctions. So D stands for disorientation, I for interaction, S for sleep-wake changes, H for house soiling, A for activity, and another A for anxiety. So actually, these pets can have one or more of the following mentioned signs. So disorientation is when you see that the pet have decreased recognition of familiar people, pets that they usually know, places. For example, you see them getting lost in familiar environment, going to the wrong side of the door. The interaction is when we see that they have decreased interest in playing, interaction with the pet parent, decreased greeting behavior, and sometimes even we see development of fear, avoidance, aggression. We see a lot of inappropriate vocalization, so barking and mewing for no reason, which is very tough on the pet, and also on the pet owner. Their sleep-wake cycle change a lot, so we see them waking up at night and increase daytime and total sleep. So, plus during night we see we hear a lot of vocalization. House soiling. So usually, and especially with trained pets, we see indoor elimination at random sites. For dogs, we see that they don't have signaling of intent to eliminate. They go outdoor and they come up, urinate inside the house. So yeah, this also is one of the signs. Change in their activity. So they have increased wandering or pacing with no aim, restlessness, depression, the decreased depression, of course, and apathy. They don't want to explore things like before. And finally, anxiety. So we see new fears that were not there before. Anxieties, over grooming, hiding. They become clingy. So you have a lot of signs that are related to cognitive dysfunction. And unfortunately, pet parents don't see them as cognitive dysfunction. They look at them as simple, normal aging process of the pet.
Yeah, no, and I think that last point that you mentioned there is so important. I think that cognitive dysfunction is massively under-recognized and underdiagnosed. And I think sometimes it's the pet parents themselves that, like you said, they don't recognize the signs as being part of a brain aging process, but they think the pet is, I don't know, like just getting older is the word I hear a lot. They feel it's somehow normal, and it isn't, because it truly is. There are changes happening in the brain, a number of different ones, which I've mentioned in one of the previous podcasts I did on this, but it's it's an actual pathology. So it's an actual disease, and there is actually so much we can do to help. But just before we kind of dive into that, I just wanted to quickly touch on the acronym that we're using for cats now. So the DISHA is, I think, very well known and widely used for dogs. But I was at a recent conference where there was a paper presented on the new acronym for cats, which is VISHDAL. So with a V at the front and an L at the end. So the other letters are quite similar, but in cats, one of the things we see mainly is increased vocalization, especially at night. And that's what the V stands for. And that's why the V is right at the front, because it seems to be in cats, the more predominant sign. So that's the V. And then the L that's added in at the end is for learning and memory, which I think we could also potentially think about adding to the DISHA score for dogs. And some of the things you mentioned, such as changes in house soiling, they're all of a sudden, especially where they've previously been completely house trained, now they're house soiling at home. Yes, it can have physical underlying reasons as well, but that loss of learning and loss of memory can be part of that as well. So there is no clinical tool available yet, unfortunately, for cats, but that's definitely something that we can think about when we're sort of questioning pet parents about their cat's behavior as well.
Interesting. I didn't know about it, but yeah, definitely night vocalization is very common, and they share. But yeah, this is the main one that I've heard of for cats.
Yeah, absolutely.
Yeah, actually, there are three common misconceptions. First, that they think that it's normal part of aging. Then they think that it's not a common condition. So they're not aware that this is really common in both cats and dogs. And the other misconception is that they think there is no effective way to manage it, and they might feel that they should leave it or maximum go for euthanasia, which is not the case. Definitely today we're going to discuss how we can help these pets to live longer, healthier, and happier with our solutions.
Yeah, no, I love that. The fact that, you know, those three common misconceptions, I've never heard it broken down like that. And that's really helpful, I think, to think about it like that. So that's amazing. And I think before we dive into what we can do to help, just one thing that you mentioned there, which I think is really important. And that's, you know, you mentioned a happier, sort of healthier aging pet. And that welfare and quality of life piece, I think, is really important. because I feel that our pets, they do so much for us throughout our lives, this amazing human animal bond that we have with them. And then when they're in their twilight years, we absolutely owe it to them to make sure that they can age as happily and healthily as possible. And I think that everything that we're going to talk about from now on is really intended to sort of provide that supportive, nurturing environment for our older pets so that they can live their best lives in their golden years.
True, exactly. And actually, we have to prepare them for this phase of life. So, intervention have to start earlier than this. And good quality of diet and lifestyle and nutrition is very important even prior to developing any of the cognitive dysfunction in order to decrease the likelihood of such conditions or delay the onset, let's say.
Yeah, absolutely. And speaking of that, there's actually one study that I found when I was studying for my board exams, which is the study by Katina et al. From 2015. It's a Slovakian-based study, but they looked at risk factors for cognitive dysfunction in dogs in Slovakia. And the thing that stood out to me, because you just mentioned diet, the thing that stood out to me was that dogs that were fed a low-quality diet, i.e. table scraps or not what we would think about a scientifically composed diet, were 2.8 times more likely to develop cognitive dysfunction syndrome. And that just blew my mind, because it's exactly what you just mentioned. It's the preparation of the pet already for that life stage. So yeah, I'd love to hear your thoughts on that.
Yeah, so actually, I was amazed when I read the study. So they compared those that were eating very good quality diets, such as Hill's Pet Nutrition, and those that were eating any kitchen scraps, mixed diet. And as you mentioned, the ones that were fed controlled diet that is appropriate for their life stage and appropriate to their breed size and to their health status, they were 2.8 times less likely to develop cognitive dysfunction. And this strong association suggests that high quality nutrition could help preserve cognitive function as dog age. And we have always to think of a balanced, controlled diet to protect our pets. And we have always to emphasize on the importance of nutritional intervention in prevention and also in the support once the condition is already there. And this study aligned with many other studies showing that dietary components like antioxidants in the diets, mitochondrial cofactors, medium chain triglycerides can positively affect brain health in senior dogs.
Yeah, no, that's amazing. Like I say, it blew my mind. I was like, oh my God, like we really have a responsibility to be advising and educating clients on that so that they can make choices that are going to be beneficial for their pets in the long term. So yeah, that's so cool.
Yeah, so but sometimes they might not see the disadvantage of giving such diets directly afterward. But as we noticed from the study, on the long run, you start seeing the effect of an unhealthy and unbalanced diet choice.
Yeah. And it's a little bit like us, right? We always have that phrase of we are what we eat. And I think in this case, it's the same thing, right? Like
100%.
Yeah.
Yeah.
So why don't we dive into some of the other dietary options that we have? So I know that Hills has some wonderful diets, or in particular one wonderful diet that can really support once the disease has already been diagnosed or once it's already prevalent. Talk to us about that.
Yeah, so actually I love this diet because Hills has authored over 20 scientific publications and abstracts along with multiple book chapters that support the efficacy of this brain diet, or the BD diet, a prescription diet, in helping to manage older dogs that have cognitive challenges. So this diet is the first pet food that combine a mix of powerful antioxidants, mitochondrial cofactors, in a clinically proven nutrition to address these behavioral challenges in older dogs. So how this diet was formulated? At the beginning, we are aware that cognitive dysfunction is a vicious cycle where we have mitochondrial dysfunction leading to free radical generation, which causes cell membrane damage, and this will further worsening the mitochondrial function. So it's a vicious cycle. And therefore, with the health BD diet, we have ingredients such as lipoic acid and high level of L-carnitine that help maintain mitochondrial health. And healthy mitochondria produce definitely fewer free radicals, so oxygen-free radicals. And this is why it improves the whole cycle. So in addition to this, we have added to this diet a clinically proven blend of antioxidants from fruits and vegetables. They have, of course, the primary function of any antioxidant is to defend the cell from free radicals and oxidation. Plus, it promotes a healthy immune system. So what we have incorporated in the diet are sources of vitamin E, vitamin C, selenium, beta-carotene, carotenoid, and flavonoids, which are already very well-known powerful antioxidants. In addition to this, it's a diet with high level of omega-3 fatty acids from fish oil to promote healthy cell membrane and to support the brain. And at the same time, it will benefit the joint health because we know that once pets, when they age, they start having comorbidities, and many of them might be also having osteoarthritis. Plus, we are aware that usually this diet is given for pets, as I mentioned, that are aging, so they don't have the best heart and kidney. This is why the diet has appropriate levels of proteins, phosphorus, and sodium to help maintain the health of the heart and of the kidneys. So, and this diet was very well studied. We have very interesting results. Originally, health research found that the diet is able to support the metabolism to produce energy for the brain and the body. And the results, so once they are on the diet, we saw that in as little as 2 months of feeding it, we saw positive effect of the diet. So it was provenly, it was shown in only 2 months. And we have also more studies that were run outside hills. For example, a study by Cotman in 2002 also investigated the effect of this BD diet on cognitive function. And they saw that with this diet, they saw significant improvement in learning and memory compared to aged dogs that were fed a controlled normal diet. It's a very nice diet, very well studied, and the results are very obvious. You can see them in as little as 2 months.
Yeah. And I absolutely love this Cotman study because I think a lot of the things that we've just spoken about are maybe a little bit difficult to grasp. Yes, we absolutely know, how important it is to reduce free radical changes and all that sort of thing. But from a behavioral point of view, the fact that the diet was actually shown to improve learning and memory. So I think, it showed dogs were able to learn, increasingly more difficult learning tasks. And I think that's something that's going to be really important for the pet parents to know that their dogs have that, better memory, better ability to learn in their old age. And that's what I really took away from that Cotman study was the kind of practical, what does that mean for the pet parent living, for the dog living in that pet parent's home. So yeah, and the diet sounds amazing. And it's really a great thing, I think, to do. And I think one of the things about nutrition is we're feeding our pets anyway. So we may as well feed them something that's going to be really helpful for them. And especially dogs with that disease. Yeah.
Definitely. I totally agree. And the good thing about this diet, so the good thing about anyways, the solutions that we have is that in some conditions where the pet have comorbidities and cannot be fed a BD diet, for example, they are on a kidney diet, still we have some other solutions that can be added, some supplements that we can add to the diet in order to have more or less the same effect.
Yeah. So shall we talk about those? As you led so beautifully into that. Yeah. Talk to us about some of the supplements that you guys have that again, are supported by evidence, which is great. We always want that. And yeah, tell us a little bit about some of those.
Yeah, exactly. So I'm absolutely in love with the diet, but as I mentioned, sometimes you have cases where they are already on the diet that have for a certain condition that cannot be changed. So the good thing is that we have a supplement from Vet Plus. It's called Activate. It also have a synergetic combination of nutrients, antioxidants, and mitochondrial cofactors demonstrated to benefit in cognitive dysfunction. So when we say demonstrated, it means we have a published study about its efficacy. So this diet support cognitive function through different mechanisms. The nutraceutical ingredients in the supplement, they act on four different areas. Some of them act on membrane augmentation, so they help maintain a healthy brain cell membrane, and this will, of course, help with better communication between neurons. And for this, we have the DHA and EPA, the most powerful omega-3 fatty acid, as well as phosphatidylserine. Another key area is signal enhancement to support the neurotransmitter function and brain signaling. And also DHA, EPA, phosphatidylserine play a role. But in addition to this, we have added acetyl L-carnitine, and coenzyme Q10 to support mitochondria, which improve energy production within the brain cell. We have the acetyl L-carnitine, and the coenzyme Q10, and finally antioxidants, of course, so to combat the oxidative stress that contribute to brain aging. So vitamin C, vitamin E, selenium, also an acetylcysteine and coenzyme Q10. So they act synergetically on these four areas. And definitely, this is pure scientific, but what really people want to know is about the effectiveness of this blend of ingredients. So, for this, we have Activate is backed by a double-blind placebo-controlled trial that was published in Applied Animal Behavior Science in 2006 by Heth et al. And the objective of this study was to evaluate the effect of Activate on dogs that have signs of cognitive dysfunction. So 40 dogs were enrolled, and they were divided into two categories, the 20 of them that were receiving the Activate and 20 were on placebo. The trial duration was 56 days, including 7 days pre-trial and 7 days post-trial. And it was conducted across 20 UK veterinary practices. So Vet Plus are products produced in the UK. And the behavior was monitored through questionnaires and veterinary assessment as well. So the questionnaires were done on a daily basis by the pet parents. And we had several veterinary assessments as well. And these questionnaires and assessments focused on disorientation, change in social interaction, sleep-wake cycle, and house joining. So as discussed earlier, the main signs, the DISHA signs. And the results were that we had statistically significant improved in the group that were on Activate. When it comes to daily sleep pattern, we saw that dogs were active for 2 extra hours per day. When it comes to recognition behavior, we saw fewer incidents of confusion or lack of recognition. When it comes to house soiling and social interaction, we saw also improved scores compared to placebo. So both owners and vets reported improved quality of life and a stronger pet-owner relationship. I think this is what we all want at the end for these pets. So we want the supplement to help them and help them with their quality of life, but also help pet owners to have a better relationship with them. And there is something interesting in the study is that also they saw that when they stopped supplementing, they saw relapse in the symptoms. So it means that these supplementations or even the diet have to be continued because we know that cognitive dysfunction is something that is we're not gonna heal from it. So it's something chronic. So this is why we have to keep giving the supplement to see persistent effect. So as a conclusion, we saw significant positive changes in both objective behaviors of dogs that are suffering from cognitive dysfunction, as well as in the perception of the dog's condition by people that are in regular contact with them. So yeah, this is in general the study. And finally, what I really like to emphasize on when it comes to this product, that it has no interaction with any other therapy. So it can be safely used with whatever multimodal approach the pet is having. Definitely, always with cognitive dysfunction, we aim for a multimodal way. We don't have one treatment. We have to include maybe medications, nutrition, nutraceuticals, environmental enrichment. So it has to be always one of these multimodal approaches.
I love that you just said that. So first of all, let me just say, I love the way you explained the study. I wish that you could have read all the studies that I had to study for my board exams and describe them to me like that.
Happy to hear that. Good.
It's such a lovely way. I think it's really easy to understand how the study was conducted and the methodology and all that sort of thing. So yeah, that was a lovely, lovely summary of the study. But I think as you said, it's really important to understand whether something will have interactions with other things, because one of the psychopharmacology solutions or treatments for cognitive dysfunction is a medication called selegiline, which is a monoamine oxidase inhibitor. And as we know, monoamine oxidase inhibitors have a lot of drug-drug interactions, especially with other serotonergic medications. And some of the other supplements potentially that we might think about using to reduce anxiety or to reduce stress may have serotonergic activity as well. I'm thinking about Angstane, for example. L-theanine has a serotonergic component to it, but so do many others. So knowing that, we can safely give selegiline, for example, with a product like Activate, I think is absolutely gold to know for us vets and also for the pet parents to know that this is a safe product.
Yeah, exactly. Indeed, it is. So we shouldn't always combining it and putting it in your multimodal approach management. You will lead to better effect and improvement in canine and also feline cognitive dysfunction.
And that was the other thing I was going to ask about. So you mentioned Activate can also be used for cats. Can you tell us a little bit about how does Activate come? Is it a capsule? Is it a tablet? What's the dose? Is it palatable? How easy is it to give? All those kind of things.
Yeah. So first, Activate comes it's for cats and for dogs, and usually with Vet Plus we always have a supplement for breed sizes as well. So which make it very convenient on the pet owner to administer it. So Activate is a capsule. We can open it and mix it with the food, or we can give it as a whole. We give it once daily. Definitely Activate for cat should not be used for dog and vice versa, and we should respect the breed sizes because the dose and the concentrations are calculated per breed sizes. And there is one ingredient, which is the alpha lipoic acid, that we have in our dog formula is not available in the cat because we know that this can be toxic for cats. So this is why we have one formula for cat without alpha lipoic acid, and other formulas for dogs, including the lipoic acid. And we have very good feedback from the palatability, so very easy to administer and very safe.
That's amazing. And I'm so glad that you mentioned that, because I think sometimes people are tempted to give maybe a small dog breed capsule to their cats, but actually knowing that the cat capsules are specifically formulated for cats for a reason, because there is an ingredient that might not be so beneficial for cats. I think that's really useful to know as well, and to maintain that safety, I think, as well for the patients.
Exactly. Yes.
Yeah. And then I think just before we move on to our final product, I just wanted to quickly touch on something that you mentioned, because I think this is such an important thing to talk about again quickly. And that is that there is no cure for cognitive dysfunction syndrome. So we can't reverse it. We can't cure it. Like you said, we can't completely heal it. However, there is so much that we can do to slow things down and to support that animal and to support that animal's experience of their life and their behavioral signs. So even though we know it's not something that we're going to cure or heal, it's so important that we still go in and give all of the supportive treatment that we can. And as you mentioned, that multimodal approach is so vital. And we've got so many different things, diet, supplements. We're going to talk about one more supplement, medications, and not just selegiline. There are other medications as well that can be supportive. Propentophyline, for example, can support the microcirculation in the brain. So lots and lots of different things, as well as environmental management, maybe behavior modification, enrichment, making things easier for our older pets. So, making the access to the outdoors easier, for example, if you've got a ramp or something like that. So and again, just coming back to this point of it's underdiagnosed, it's underrecognized. People don't think there's anything we can do. Yes, we can't cure it, but there is so much we can do.
Yeah, exactly. And the earlier that we detect it and the earlier we intervene, the sooner we start the treatment, the better would be the outcome. So this is why we always recommend some questionnaires to be done starting at 8 years of age, and trying to assess at least one of the symptoms is important. So as soon as you have one symptom of cognitive dysfunction, you can start immediately on these nutraceutical supports and dietary modifications to help delaying the progression of the disease. So this is the recommendation, I think, and definitely we should always think of a long-term management. So we cannot just put the pet on 2 months of supplement and then start it and then stop it, because as we saw in the study, the effect will decline if we stop the product.
Yeah, no, absolutely. Absolutely. And I think that I love that what you just said. As soon as you've got just one sign, that's already the time to start. Like, don't wait for multiple signs plus maybe comorbidities and your pet's really struggling, and then all of a sudden you think, oh, maybe I better do something. It's that early intervention piece, I think, that is so key.
Exactly.
Yeah.
So because of this podcast, I hope many pet parents, after listening to the symptoms that can be leading to the diagnosis, they can start spotting if their pet is having any of these symptoms and start intervening the earliest possible.
Yeah, no, that's what we're hoping. So everybody listening to the podcast, look at your pets, observe them.
Exactly.
Okay, let's move on to our final thing that we wanted to chat about. And that is, so there's been a lot of conversation in the last few years around medium chain triglycerides as an alternative energy source for brain health, especially in the aging brain. And there are diets available. However, there is now also a great supplement, also by Vet Plus, which is an MCT supplement called Acrylic. I don't know, somehow I'm struggling with that name, Acrylic. So maybe you can chat us through that a little bit. And also the great news is it's a product for dogs and cats. So go ahead.
So first, acrylic is definitely, I agree with you. We have recently growing research to support the use and the role of medium chain triglyceride in improving cognitive health. We are aware that there are diets maybe in the market that are enriched with MCTs, but the problem is that when the pets age, they might have comorbidities, as we mentioned earlier, like diabetes, kidney diseases, whatever. So we usually put them on certain diets for these diseases, and we tend to ignore the cognitive dysfunction. So now, thanks to this acrylic supplement, which is a pure medium chain triglyceride supplement derived from coconut oil, you don't need to change the diet. You just need to add it to their dietary plan. So it contains a blend of 60% caprylic acid and 40% capric acid, and these are the two MCTs that have been shown to positively influence the brain activity. Now, what happens is that, as we know that when pets age, their ability to use and to metabolize glucose as a source of energy decline. And the good thing about MCT is that they are rapidly broken down, rapidly absorbed, and they are converted by the liver to ketones. And ketones are alternative energy source for the brain, especially when glucose, which is usually the preferred fuel source, is not being metabolized efficiently. Medium chain fatty acid and ketones can cross directly the blood-brain barrier, and this will allow them to directly nourish the brain cell. And this mechanism helps in cognitive dysfunction. So actually, there is a study done in 2010 by Pan et al. That compared the effect of placebo with versus pet supplemented with medium chain triglyceride in senior dogs that are over 8 years. And so the dogs that were receiving medium chain triglyceride showed significantly better results in cognitive function tests compared to those that were on placebo. So these findings suggest that medium chain triglyceride can be a powerful nutritional tool to support brain function in older pets. And the good news is that acrylic has also been proven to be well accepted. So we did an external palatability testing, and 90% of the dog accepted acrylic, and it did not negatively affect their overall food consumption because it's something that we added to the diet. So it's something easy and stress-free to add it to their daily feeding routine. So it's a very nice product, very efficient. It supports cognitive function, it improves the quality of life, and it can be part, as I mentioned earlier, of a multimodal approach for senior dogs and also potentially for cats. And I remember I discussed one time with you that you also tried it on cats and you got very good palatability. Can you tell us a bit about your experience with it?
Yeah, it's actually so funny. I was just thinking exactly the same thing because I've been a little bit skeptical when it comes to cats, because before acrylic was available and we didn't have a diet for cats that contained medium chain triglycerides, I actually used some coconut oil, like human grade MCT coconut oil, for cats, and the palatability was horrible. They hated it. It was almost impossible to get them to take it. Well, it was impossible. So we soon aborted that. So when you told me about acrylic and you said, we can use it in cats, I was like, a little bit skeptical and wasn't sure what was going to happen. And then we actually got a sample from you and we used it on some of our cats in the hospital, and the palatability was great. Even, cats that were in hospital, so in an unfamiliar setting, took the acrylic really, really well. So it's definitely now something that I have gained confidence in, and I'm going to recommend definitely for senior cats, for any cat that might be showing behavioral signs or signs of cognitive dysfunction, older cats. So it's great to have a product, because I always feel that cats kind of get left behind. There's so many more diets for dogs. So the BD diet also isn't available for cats, sadly. So there's a lot more out there for dogs. And so I was just delighted to hear that there was something that we could actually also use for cats.
Yeah, amazing. And also I need to mention one thing, that because you mentioned that you tried several sources of maybe coconut oil to use. And I would like to highlight the fact that acrylic is pure MCT from coconut oil. So when we give coconut oil, coconut oil is a source of MCTs, but also source of saturated fatty acids. So This product is just the medium chain triglyceride part of the coconut oil, and specifically the caprylic and the capric acid. This what makes it a very higher alternative on using just simply coconut oil.
Yeah. No, that makes total sense to me. And I'm glad you highlighted that again, because even just the thought of getting coconut oil and giving it to a cat, I didn't feel kind of comfortable doing it, but we didn't have any other alternatives. And, you want to try and do something to help them, and it just didn't work. So knowing that there is something on the market that's for cats is just amazing.
Yeah.
Perfect. All right. So I think let's conclude. Do you have any final comments, anything that you would like our listeners to know? And obviously we've got pet parents and vets that listen to this podcast. So it'd be great if you could give some final parting words to both pet parents and veterinary professionals.
So at the end, definitely nutrition, nutraceuticals, as you mentioned, medications are all useful in managing the condition. But also we should never forget the environmental enrichment. And there is something I like always to say: what you don't use, you lose. So as with human medicine, enhanced interaction and enrichment can improve cognitive dysfunction. There are a lot of lifestyle managements for dog and cat that can be implemented, such as physical exercise, social interaction, cognitive training, so training them again and again. Keeping them fit also is something important. Taking them for several walks throughout the day showed to benefit. Recall games, simple commands like sit, stay down. So these simple stuff, and rewarding them when they do the correct response. Everything that we can, so all the efforts that we can put on our pet will eventually give us a better lifestyle and a better welfare for the pet, definitely. And finally, for cats, we should never forget, of course, you are the pioneer in this field, but we should always aim to reduce stress, because this can really improve their cognitive dysfunction as well.
Yeah, absolutely. And I love all those things you just said. And of course, I'm a massive advocate for enrichment as much as possible, and for keeping those very simple cognitive skills awake. Like you said, it doesn't have to be difficult, but sometimes you can play very simple games with dogs. Like you have a couple of paper cups, and under one of them there is a treat, and they need to use their noses and maybe their cognition remember which cup it was under. So there are so many very cool, very simple cognitive games that can be played with dogs and with cats. So yeah, I think for me, my final words would be: please don't underestimate this condition. Please observe your pets. If you're pet parents, look out for those signs, look out for them early, mention them to your vet, and be active early on. And for pet professionals, especially for vets, we need to diagnose these conditions more. We need to be better at, like Gaelle mentioned, supplying a simple questionnaire for any patient over 8 years of age that the client can complete whilst they're in the waiting room, and is something that they can, you can just have a glance through as you're doing your history collection, and just to see, are there any changes that this pet is showing from a cognitive point of view? Because if they are, now's the time to start getting active. Maybe starting with a diet, starting with some supplements, addressing lifestyle, all those things that can be so crucial as we've been talking about. So those would be my parting words.
And another thing, there is a study showing that 75% of senior dog owners that reported behavioral changes consistent with with cognitive dysfunction, only 12% of them raised this concern with the vet. So usually they don't discuss it with the vet, because maybe they think it's normal aging, and if there's not something related to the parameters or signs that you see very obvious, like a wound, that we will not discuss it. But no, actually we should discuss and open up to the vet, because we can help your pet to feel to live the last few years of life in a better condition for you and for the pet. So improving the quality of life for the pet and for their caregiver is our aim always.
Yeah, absolutely. And I love that you've just said this, because this is the story of my life. This is the story of veterinary behavior medicine. Pet parents absolutely understand and recognize when their pets are physically unwell. And it's very rare that pet parents will raise a behavioral concern during a veterinary consultation. They're either not sure whether they should bother the vet with that. They're not sure if the vet's the right person to mention that to. Like you say, maybe they think it's normal. Maybe they're just kind of living with it. Maybe they're accepting it. And this goes not just for cognitive dysfunction. This goes for all, all behavioral signs. The number of times that a pet parent, as they're leaving the consult room to go back out to reception, they'll turn around and say to me, "Oh, and by the way, my cat started peeing outside the litter box."
Yeah.
And you're like, okay, maybe we should have talked about this at the beginning of the consultation, not the end. So absolutely, 100%. I completely agree. And I think this is the perfect place to leave this conversation, because this has summed up everything I think that we've tried to convey today. So it just remains for me to say thank you so much for your time. It is always such a pleasure talking to you. I love the conversations we have there. So I learn something every single time, and it's hugely enriching for me. And I really appreciate your being here and chatting about this really important topic.
I'm the thankful one for having me in with you. Discussing with you is always something that gives me happiness. Honestly, you're someone very knowledgeable, that have a strong experience in the field. You are a key opinion leader for us, for all of us in the MENA region. We're very proud to have someone with your level of expertise and your level of dedication to the behavioral medicine. Thank you for having me, and I hope the episode is beneficial for the listener, for the pet parents that are listening to us today.
I'm sure it will be. Thank you so much for your kind words, and I'm sure we will see you again on this podcast very soon.
Sure.
Thank you. Bye-bye, everyone. Bye. See you in the next episode.
Bye.